So you are a transgender boy. You know what that means?
So you were born a girl, but you feel like a boy, right? That kind of means you're transgender. Okay? And that's okay, but that's just the term for it. Do you like doing quiet girly activities, or do you like jumping around and being crazy and tackling everybody?
Boy activities.
Boy activities.
Imagine you are a parent, and after months of depression and self-seclusion, your child comes to you, anxious and fearful, and says, "I'm transgender." Maybe your child has written out a list of demands to alleviate their dysphoria. Maybe they let you take the lead. Either way, when you take your child to the doctor, to a therapist, to whatever medical authority figure you trust the most, or even just a quick internet search to find other parents with similar experiences, they will advise you that the path ahead is either transition, which includes cross-sex hormones, medically unnecessary mastectomies, and penis inversions, or that your child will kill themselves.
I wish I had more answers for you. What I can say is you're not alone. Parents and caregivers of transgender children are terrified right now. Regardless of the state you live in, it's our country. It's the fact that we have an election year next year that scares me, even being in California. There's a couple of things I would suggest just out of the gate that may sound either like you've heard them 100 times, or maybe it's the first time you're hearing it, but as when you get on an airplane and you put your oxygen mask on first before you take care of someone else, you have to take care of you. Your mental health is number one and most important. Make sure that you're taking care of you, because your child needs to feel safe and needs to feel like you are secure in where you're at in order for them to trust that everything's going to be okay. Number two, I would say if you have local organizations like PFLAG or others that you can tap into, and you can find a community and a network of other parents in your area and share resources, that's definitely something that is very, very important. There is a group within Gender Spectrum. I'm actually a facilitator for one of their parent groups. They meet bi-weekly online via Zoom, and we talk. We talk about all of these things. It's not a therapy session, it's a peer group. It's parents that get each other and understand what we're going through. Get the support that you need, and also have, as crazy as it sounds like literally zombies are coming, which some of these people technically could be considered zombies. Have an exit plan. Have a way to know that you can get out. Find family that lives in another state. Work with other families to see what they're doing. And it's really about strength in numbers right now. Just take care of you, take care of your kiddo, remind them repeatedly just how loved, affirmed, and special they are, because they really are. These are amazing little humans, and I really wish that some of our politicians would take more time getting to know them instead of trying to get rid of them.
You might think of doing therapy first, but the mere suggestion of doing so is often conflated to be the exact same thing as homosexual conversion therapy. Gender dysphoria is defined as a state of severe distress or unhappiness caused by feelings that one's gender identity does not match one's sex as registered as birth. In the DSM-5, it has been its own category with a list of symptoms and behaviors required of diagnosis. However, in recent years, the belief that gender dysphoria is an illness one needs to be diagnosed by a medical professional has been superseded by a rise of self-identification, wherein merely stating identification with the concept of transgenderism is enough to be transgender. The treatment for gender dysphoria is commonly a medical and social transition, with therapy often being considered a detrimental practice due to the flawed 2020 study by Turbin et al. Titled Association Between a Recalled Exposure to Gender Identity Conversion Efforts and Psychological Distress and Suicide Attempts Among Transgender Adults. Through this study, Turbin et al. Found that survey participants who responded affirmatively to the survey question, did any professional, such as a psychologist, counselor, or religious advisor, try to make you identify only through sex assigned at births? In other words, try to stop you being trans. Reported poor mental health in those who responded negatively to the question. From this, Turbin et al. Concluded that gender identity conversion efforts are detrimental to the mental health and should be avoided in children, adolescents, and adults. However, the researchers failed to note the use of a biased data sample, reliance on survey questions of poor validity, and the omission of a key control variable, namely subjects' baseline mental health status within their study, which throws the validity of their results and conclusions under the bus. This way of thinking, that all therapy which seeks to determine a source of gender dysphoria, which is still defined as a mental illness, is harmful, ignores the existence of any other mental illnesses which may cause or play a role in gender dysphoria. In fact, under current affirmative treatment models, it is believed that addressing gender dysphoria will automatically solve any other issues that a patient has.
A board-certified endocrinologist practicing in private practice for the last 16 years. I've been studying and publishing in this area for the last 5 years, including peer-reviewed journals such as Journal of Clinical Endocrinology and Metabolism and others. I also have a patient who is a detransitioner. I think it's important to note that studies have shown that desistance, or growing out of this condition, of children by adulthood is very high, some 50 to 98%. I want to be sure before I give someone a very powerful hormone like insulin that they in fact have diabetes. What about cancer? Before we give any powerful agents such as chemotherapeutics or surgeries, we certainly want to have physical evidence of this problem, such as biopsies or imaging. Now, the gender affirmative therapy treatment proposed by WPATH gives very powerful hormones and surgeries. On what basis? Where can we find the gender identity to be certain that these children will not desist by adulthood? Can we use imaging of the brain or blood tests, genetic testing? Are there other biomarkers to ensure that we are correct? There is no such thing.
The Endocrine Society put out guidelines in 2017. And they were very careful in the guidelines, one, to point out that the evidence was of low and very low quality. And they also said in the guidelines that they have no idea how you identify which kids are trans and require this treatment. And then the American Academy of Pediatrics the next year just leapt into that void and said, oh, we'll tell you how you know which kids. You ask them. Prior to 2018, I had maybe one trans patient. But then there was another one, and another one, and another one. It wasn't until later that I started asking questions like, wait, every single kid I send to the gender clinic gets put on puberty blockers or cross-sex hormones. It was happening immediately.
This affirmative model of care has spread wildly in the last 8 years. Now we have objective, unbiased, systematic reviews. These systematic reviews tell us the evidence for youth transition is poor quality and with very low certainty for benefit. In JAMA Pediatrics, there was a study reported from Northwestern University in Chicago. Patients ranged in age from 13 to 24 years. The authors concluded that mastectomy was beneficial and should not be delayed in youth. What led them to that conclusion? The finding that 3 months after surgery, the 36 patients were happy with their flat chests. They lost 9% of their surgical cases to follow-up. 9% in 3 months. It is absurd, meaningless to draw any conclusions after 3 months. This paper is indicative of the quality of research we have in this field, published in our most prestigious journals. We have a serious problem.
This is known as the intervention causation fallacy, which refers to the erroneous belief that one's ability to change an event proves what originally caused the event. In other words, if depression or anxiety is alleviated by treating gender dysphoria, it's assumed that the dysphoria caused the depression or anxiety. Comorbidities is a very big problem within the trans community, as over half of participants reported having at least 3 diagnosed comorbid conditions, with the most prevalent diagnosed comorbid conditions being depressive disorders and anxiety disorders, including PTSD. And yet, gender affirmative treatment does not question if these comorbidities may play a role. Instead, they are used to support the conclusion that the individual has come to, with the individual's self-diagnosis holding more weight than the clinician's. The theory of minority stress states that the frequently co-occurring psychiatric symptoms of gender dysphoric individuals are a result of prejudice and discrimination brought about by gender nonconformity, and that gender transition will ameliorate these symptoms. According to Levine, clinicians who subscribe to the gender affirmative and minority stress models of care assume that gender dysphoric children and teens have the best understanding of what they need to be happy and fulfilled, and demurs their judgment over that of healthcare professionals. Questioning if their dysphoria may stem from social influence or other mental health issues is portrayed as being the same as conversion therapy. Conversion therapy is a misnomer. It refers to an abusive and ineffective process meant to change a homosexual person into a heterosexual person. Over the years, conversion therapy has included practices like aversion therapy, using electric shock and nausea-inducing drugs in an attempt to create disgust at same-sex erotic images, ice pick lobotomy, testicle implants and hormone treatments, emotional manipulation and torture, as well as surgical castration. Any studies which argued that sexual orientation was changed during the duration included participants which today will be labeled as bisexual, and were unsuccessful in long-term change. Some argue, even today, that sexuality is mutable, that homosexuality is created from the conflation of behavior, desire, and identity of which all three can be changed. This practice is nowhere near the same as therapy by licensed medical professionals to determine why an individual feels uncomfortable in their own body. Because let's make one thing clear. Gender dysphoria is a mental illness. It's not a choice. Choosing to identify as transgender is a choice.
There's no such thing as transgender people. What there is people and children who feel very uncomfortable with their bodies. They can feel uncomfortable with the sex of themselves. They could be very uncomfortable being male. They can be very uncomfortable being female. They can be very uncomfortable with their place in the world as a male or female, for whatever reasons. And there might be reasons, but no one's allowed to ask what those reasons might be, because it's transphobia. And you're just supposed to pretend like these people are born hating themselves and wanting to cut parts of their body off. We're supposed to believe that people are born to want to cut parts of their body off. Fuck you. Okay? Fuck you. No one's born wanting to do this. People out here right now have severe emotional distress over their bodies. Nobody's helping them. No professional is helping them. No medical establishment is helping them. No therapist. Well, I take that back. Some are trying. The therapeutic community, the mental health community at large, based on the DSM, all-knowing DSM, pray to the DSM. According to the DSM, it's perfectly fine to chop people's bodies up if they feel uncomfortable with their bodies. How fucking dare you feel uncomfortable with being a male or a female? How dare you? No. That is too extreme. Too rare. There's no way. I could not even... How can anybody ever feel uncomfortable with their sex? Unbelievable. So unbelievable that we're not going to ask questions about it. We're not going to try to treat it therapeutically. We're not going to try to keep the person whole and healthy. No, we're going to send him to a butcher. We're going to send him to a plastic surgeon, and we're going to cut off parts of their body and leave them scarred for the rest of their fucking lives.
No one should face conversion therapy to change their behavior to conform to the expectations or desires of others. It doesn't work and is classified as a form of torture. Receiving therapy from a licensed professional to address causes for not wanting to be male or female is not anywhere near the same thing. Comparing therapy for gender dysphoria to gay conversion therapy is harmful and inaccurate. It reinforces the idea that gender being innate through the presentation of gendered souls placed in incorrect bodies, rather than being a delusion that society has decided to treat as a rational observation. This comparison also dissuades individuals from seeking necessary and beneficial treatment for gender dysphoria without resorting to medical transition, which is detrimental to one's health. Comparing psychiatric treatment to conversion therapy is just another way in which the trans community co-opts the struggles and experiences of other minorities, and fearmongers within the trans community, further creating an environment of fear that keeps trans-identified people from seeking help off the beaten path. This, dear viewers, is where we part. Conversion therapy is something that has been often conflated with literally just regular therapy because therapy's in the name. And the thing is, conversion therapy was torture. It is torture. It is not the same thing as having a therapist ask you if maybe you're being assaulted a few years ago might have led you not wanting to be a woman. And it's not the same thing as asking someone if their fetish might impact how they view themselves. Not the same thing in any way. And I find it especially egregious and harmful that anyone decides to conflate the two.